Pokhara, one of the gateways to the Himalayas, is a popular tourist destination in Western Nepal. Like other rapidly urbanizing metropolitan cities in South Asia, Pokhara faces various challenges, including increasing population, unplanned infrastructure development, and lack of people's access to basic services. The Constitution of Nepal envisions providing good quality, free basic health services to its citizens, which is the prerogative of the local government of Pokhara. Urban poor exist in many forms. They include daily wage earners, people living in slums, and those marginalized on the basis of caste, ethnicity, and disability. Identifying the urban poor and increasing their access to basic health services is challenging for local policymakers, as currently there is no data available at the local level.
हामी त पहिलाचोटी हामी कहाँ छौं भन्ने नै हामी अन्यलमा थियौं के गत वर्ष.
Health system barriers like inadequate human resources also make it difficult to create new health programs to reach the urban poor.
हामी दुई जनाले मात्रै हाम्रो टोटल पपुलेसनको 12,000 जनालाई सेवा पुर्याउनु भनेको चाहिँ हाम्रो लागि एकदमै चुनौतीपूर्ण हुन्छ. त्यही पनि हामीले आफूले सकेसम्म राम्रो तरिकाले नै सेवा दिन कोसिस गरिरहेका छौं.
Along with various health system side barriers, lack of trust in government health facilities lead people to seek health care from informal service providers.
साथीहरुले बुझ्न सकेका छैन सरकारी दबाई त गतिलो हुँदैन भने सबभन्दा राम्रो छ त्यही दबाई त्यहाँ यहाँ निशुल्क पाउँछ. वहाँ पैसा तिरेको मान्छेको मानसिकतामा परिवर्तन गर्नलाई निकै अझै समय लाग्ला जस्तो. पहिलाको लेखि त धेरै परिवर्तन भएको छ.
Hence, the formal health system does not reach the urban poor and marginalized groups of people. Jinta Devi Shah and her husband have spent 25 years in Pokhara as scavengers. They raised their 3 children in this slum. Their first contact point for seeking healthcare is the local pharmacy, popularly known as medicine shop in Nepal. Meena and her husband Gupta Nepali struggle to improve their lives by collecting sand in Seti River. This Dalit couple lives in a rented room on the outskirts of Pokhara with their 3 children. Meena has never visited local health facilities. She prefers to go to the nearest pharmacy. In spite of various challenges within these urban complexities, the government of Nepal has established Health Facility Operation and Management Committees, HFOMC. The HFOMC is a group of 7 to 8 local people, including locally elected representatives and representatives from the marginalized groups of people who oversee the functioning of health facilities to provide quality basic health services. As part of the social accountability mechanism, the HFOMCs have to reach out to marginalized people and address the barriers these people face while seeking health care. HERD International, a national research organization, is working in Pokhara to facilitate these HFOMC members in 2 wards, to identify these urban poor living in their community via social mapping, to validate the existence of these identified people by reaching out to the community, to formulate an action plan to increase health service access to these marginalized people, which can be implemented as per the annual work plan and budget.
रिसर्च अब हामीसँग भयो तथ्याङ्क भइसकेपछि के छ भने हाम्रो ठ्याक्कै फोकस ग्रुप के हो र फोकस गर्न पर्ने एरिया के हो हामीलाई थाहा भयो के.
We see the potential in empowering all members of the HFOMC, particularly the representatives of the poor and marginalized groups, enabling them to participate during decision-making processes regarding their health needs. Our research has shown that Engaging with HFOMC members and enhancing their capacity generated greater realization amongst them to identify the urban poor and marginalized groups of people in their community. It helped them to validate the existence and location of these identified marginalized groups of people following a systematic process. And it also helped to develop a health plan to increase their access to health services. This entire process has helped to generate social accountability measures linking the HFOMC with the community.